Welcome to EMS Fall Prevention. This educational topic is hosted by Nicole Shaughnessy with St. Mary of the Woods College. At the end of this educational opportunity, I would like for you to be able to understand and verbalize the importance of fall prevention. Verbalize any risk factors that you may have for falls, and verbalize how to decrease your risk for falls. Did you know that 1 in 4 Americans aged 65 and over falls each year? Every 11 seconds, an older adult is treated in the emergency room for a fall. Every 19 minutes, an older adult dies from a fall. Falls are the leading cause of fatal injury and the most common cause of non-fatal trauma-related hospital admissions among older adults. Falls result in more than 2.8 million injuries treated in emergency departments annually, including over 800,000 hospitalizations and more than 27,000 deaths a year. In 2014, the cost of fall injuries cost Americans $31 billion. The financial toll for older adults experiencing falls is expected to increase as the population ages, and we may see it reach just under $70 billion by the year 2020. How do falls affect EMS? Falls are the leading cause of emergency department visits and death in adults over the age of 65. Among people aged 65 and over, falls accounted for 17% of all EMS calls in the year 2012. That resulted in more than 1 in 5 of these calls not needing transport, which could be for a various number of reasons, whether they were not injured, whether they were treated on scene and released, or if they refused medical care. And for those that were transported, a paramedic, instead of an EMT basic, was required to treat the patient 81% of the time. Falls have a significant impact on EMS in today's society for multiple reasons. First, they can cause a delay in response for other emergency calls that might mean the difference between life and death for your neighbor or friend who may be suffering a heart attack. They also cost EMS millions of dollars each year due to the significant cost of emergency response, having 2 staff members for every 1 patient, the ambulance's inability to respond to other emergency calls, the cost of readiness and having that ambulance available to respond at a moment's notice, and the cost of fuel, maintenance, and upkeep on the vehicles. Now let's talk about some of the risk factors of falls. And you may notice that some of these you are experiencing in your own home and you didn't even notice it. They could be putting you at risk for significant injury related to fall. So some of the risk factors that we have that are not related to living conditions are medications that you may take. And we'll talk about that a little further here in a few minutes. Your cognitive status, any confusion that you may have, any history of falls that you've had, diseases that affect your balance or your gait, such as Parkinson's disease, if you've had a history of a stroke, the inability to get up from a chair without using the support of one arm, and balance issues. Sight and hearing problems go along with this. Disease processes such as osteoporosis that cause weakening of the bones. Dementia, being forgetful or confused. The use of assistive devices such as walkers or canes. And physical inactivity. Many older adults are on numerous medications. These medications can put you at risk for falls. A few of the main medications that are associated with falls are medications such as anticonvulsants, which are used for seizure disorders, antidepressants, antihypertensives or your blood pressure medication. They can lower your blood pressure and make you dizzy. Medication for Parkinson's disease, and medication for mental disorders. Along with medications like digoxin, many of you may take that for your heart. It helps to slow down your heart rate, but it can also cause you to become dizzy and lose your balance. Diuretics, many of you might take those. It increases your frequency of urination and the urge to use the restroom. Laxatives for those who have bowel problems. It increases your urge to have a bowel movement. And opioids or pain medications that can make you sleepy, drowsy, or confused. Now let's talk about some risk factors for falls related to your living conditions. Do you have stairs in your home? Throw rugs in your home? Clutter, books or magazines laying around in living spaces? Or poor lighting? Let's talk about some of the floors in your home. When you walk through a room, do you have to walk around furniture? If so, you should consider asking someone to move the furniture for you so that your path is clear. Do you have throw rugs on the floor? If so, consider removing the rugs, or if you don't want to remove them, use a double-sided tape or a non-slip backing so that the rugs won't slip. Are there papers, books, towels, shoes, magazines, boxes, blankets, or any other objects on the floor? If so, be sure to pick up these objects and keep other objects off of the floor. This will decrease your risk for tripping. Do you have to walk over or around any wires or cords, like lamp cords, telephones, or extension cords? If so, coil and tape the cords and wires next to the wall so that you can't trip over them. If needed, have an electrician put in another outlet for you. Let's talk about some of the risk factors of stairs and steps that may be in your home. Are there papers, shoes, books, or other objects on the stairs? If so, be sure to pick these objects up and keep them off the stairs. Are some of the steps or stairs broken or uneven? If so, we need to reach out for help to have someone fix and repair these. Are you missing a light over the stairway? If so, you can consider having an electrician put an overhead light at the top and bottom of the stairs. Or light switches around your stairway. Do you have just one at either the top or the bottom of the stairs? If so, you should consider having another one put in so that you don't have to go either up or down the stairs to turn on the light. Has a stairway light bulb burned out? If so, this is a simple and easy fix. Have a friend or a family member. Let's discuss some of the risks that you may find in your kitchen or bathroom. In your kitchen, are the things that you use often on high shelves? If so, you should move the items to the cabinets that you can reach easily or to lower shelves about waist level. Do you have to use a step stool to reach anything in your kitchen? If so, is it uneasy? If you absolutely must use a step stool, get one that has a bar that you can hold on to. You should never use items such as chairs for step stools. In your bathroom, is your tub or shower floor slippery? If so, put a non-slip rubber mat or self-stick strips on the floor of the tub or shower. Do you need additional support when you get in and out of the tub or shower, or even up from the toilet? If so, considering having some grab bars placed next to your toilet and in your shower to assist you with steadying yourself. Is there a light near your bed? Is it hard to reach? If so, place a lamp. Now let's talk about some of the things that you can do to help prevent falls. Exercising. You need to be doing some exercises that improve your balance and make your legs stronger. All it takes is light exercise 1 hour, twice a week. Be sure to reach out to your physician about this. I'm sure they can help provide you with some handouts for exercises that would be best for you. Have your doctor or pharmacist review your medications. Make sure that the side effects aren't going to put you at increased risk. Be sure to have your eyesight checked once a year. Any changes in your vision can cause increased risk of falling. Be sure to get up slowly after you sit or lie down. We talked earlier about how some of your medication can make you lightheaded or dizzy. It's important to get up slow after you sit or lie down. You need to be wearing shoes, both inside and outside of the house. No slippers should be worn, and you shouldn't be going barefoot. Work on improving the lighting in your home so that you have equal lighting throughout your entire home. For those of you who have stairs or steps, consider putting a contrasting color on the top edge of all of the steps so that you can see the steps better. If you have wood steps, consider painting the edge of the step a light contrasting color of paint so that it makes it more easily visible for you. And consider wearing an alarm device that will call for help if you fall and you can't get up. Some of the things that you can do in your home to help decrease your risk of falling are installing items such as grab bars, lifted seats, transfer seats, night lights as we discussed earlier, or even something as simple as a non-slip shower mat. In this slide, you'll see the bottom left-hand picture is an image of grab bars that can easily be installed next to your toilet or your shower. And on the photo to the right, you'll notice that that's a lifted seat for the toilet with bars to help steady yourself as you sit and stand. If you use assistive devices such as walkers or canes, or even mobility scooters, make sure that you have them checked for a proper fit. Your walkers and canes need to make sure that they are properly sized for your height. If you're not able to do exercises on your own at home, ask your physician for a referral to physical therapy to help increase your activity level and to keep your strength. Screw it up. So what actions can EMS take to help prevent falls? We can start with patient education while we're on scene. For those patients that call 911 that don't require ambulance transport, provides an optimal opportunity for EMS to review the CDC fall prevention checklist that we just went over a few moments ago. We can leave a copy of that with the patient so that they have something tangible in their hands to reference, to go back to help make changes in their home to make it more safe for themselves. It's also something that we can provide to their family members or caregivers to help support them in making the adjustments needed for their family member to decrease the risk of falls. For those patients that we do transport due to their injuries, we can request that the hospital make a referral to social services. And we can also request that the hospital make a referral to physical therapy. Normally this takes communication with the emergency room physician, as EMS can't do that on our own. We can also leave contact information with the patients and their family members regarding local organizations to help with accessibility, such as organizations that provide ramps and install them, organizations or contractors that may donate their time or services to install grab bars in the home or lifted seats, or even individuals and handymen in the community that might be willing to come around and change their light bulb. Let's do a little review on the importance of fall prevention. Remember that falls are the leading cause of fatal injury in older adults. The financial toll for older adults is expected to increase as the population ages, and it's expected to reach nearly $70 billion in the next 3 years. Falls are the leading cause of emergency department visits for adults aged 65 and over. So, we're going to take a short quiz just to make sure that you've pulled away the key points today that you're going to need to help make sure that you are doing everything in your power to prevent falls at home. The first question that we have is, can medications that you take increase your risk for falls? Yes or no? The correct answer is A, yes. As we reviewed earlier, medications can easily increase your risk for falls. It's important that you review your medications regularly with your doctor or pharmacist. Question 2. Throw rugs in your home will not increase your risk of falling. True or false? The answer to this is B. That's false. Throw rugs do increase your risk of falling as they're a trip hazard. You should either remove your throw rugs or use double-sided tape or non-skid pad underneath your throw rug. Question 3. What home modifications can easily help reduce your risk of falling? A. The use of grab bars. B. The use of lifted seats. C. The use of night lights. D. Good lighting throughout your home. Or E. All of the above. The correct answer for this question is E. All of the above. We discussed the importance of making home modifications if any of these fit your needs at home. And our last question is 1 hour of exercise twice per week can help improve your strength and balance. Is this true or false? The answer to this question is A. That's true. Light exercise just twice a week for 1 hour can help improve your strength and balance. A few options you have for this are asking your physician for an exercise sheet that they can give you to work at home for exercises that would be just right for you, or request a referral to physical therapy so that the physical therapist can help determine what exercise would be best for you. That concludes our program today. Does anyone have any questions? I'll be more than happy to answer them for you. Thank you very much for your time. Please feel free to see me if you have any questions.